Your laboratory may be processing conventional Pap slides using the BD imaging technology. The BD Focal Point GS imaging system improves the quality of the slide reading by directing the cytotechnologist's attention to the places on each slide most likely to contain an abnormality. When used to screen conventional slides, this instrument works best if samples are collected in a standardized manner. It is essential to review the conventional collection method to collect a Pap smear in order to ensure that the conventional samples can be imaged. Just follow the steps covered in this program to achieve the greatest benefits from the imaging technology utilized at your laboratory. Collecting a conventional cervical sample is easy when you use the specially designed Rover cervix brush. The cervix brush has flexible bristles that conform to the patient's cervix during collection. The entire transformation zone can be sampled using this one sample collection device. The Rover cervix brush can be used with the majority of patient populations, including pre- and postmenopausal women. The bristles are designed to provide a gently scraping edge when rotated in a clockwise direction. Look closely and you will notice that the bristles are flat on one side and rounded on the other. It is important to turn the brush in a clockwise direction so that the flat edge gently scrapes the cells from the cervix. Simply collect the specimen using the brush with the techniques described in this program. It is easy to use the Rover cervix brush. After visualizing the cervix, simply insert the extended bristles on the tip of the Rover cervix brush into the endocervical canal. As you begin to rotate the brush clockwise, the extended bristles will stiffen and penetrate the cervical os. Maintain gentle pressure in the direction of the cervix until the lateral brush bristles splay out over the ectocervix. Maintain this gentle pressure and rotate the brush 5 times in a clockwise direction by rolling the shaft between your thumb and forefinger. It is essential to rotate the brush 5 times to ensure that a good endocervical component is sampled. Prior to collection, a glass microscope slide should be labeled on the frosted end with a patient identifier according to your office procedure. Once the sample has been collected, paint the entire length of the clear portion of a glass slide with one side of the brush. Then turn the brush over. Paint the entire length of the slide again, as demonstrated. Ideally, the smears made by each side of the brush should overlap. You should avoid placing the collected sample on the frosted end of the glass slide. After applying the sample to the glass slide, immediately spray the slide with fixative. The spray fixative container should be held 12 inches away from the slide while spraying the fixative. It is important that the cells be fixed immediately after they are collected and applied to the slide to prevent air drying. Air drying can create artifacts that make interpretation of the sample difficult for the laboratory. Another way to fix the cells is to place the entire slide immediately into a container of alcohol after the collected material is deposited on the glass slide. The sample vial should then be labeled and the requisition should be filled out in accordance with your office practice. Once this is done, the sample can be sent to the laboratory for imaging and interpretation. Thank you for reviewing the technique for preparing an adequate conventional slide. If you have time, we'd like to suggest that you view the introduction and the other sampling techniques covered in this program. By doing so, you will learn about the benefits of the BD SurePath liquid-based Pap test. The BD SurePath system provides you a clearer approach to patient management by offering the highest disease detection approved by the US FDA, combined with a low ASCUS rate and a statistically significant reduction in unsats. BD is dedicated to improving people's health throughout the world. We couldn't achieve this goal without the help of our customers. You have become an important part of our mission, and we'd like to thank you for the vital role you will play in reducing the spread of infection and improving disease management globally. We hope that in the future you will also choose the BD SurePath liquid-based Pap test for your patients.